Well, now we move on to a rather harrowing story about a child and his fight for survival. Any parent's greatest dread must be discovering that their child has an illness to which medicine has no cure. Now, they're rare now, such diseases, and hardly a month goes by without some new breakthrough in illnesses that were once tantamount to a death sentence. But often these advances depend heavily on the willingness of patients to put themselves through new and sometimes fairly risky treatments. Now, what do parents do when faced with that terrible decision on behalf of a terminally ill child? Fran Morrison has been finding out about a current and a heartbreaking example.
A warm spring Saturday in Oxfordshire, and for 15 children and their parents, a pleasant day out. But this isn't just a social get-together. It's the meeting of a parents' self-help group for families who share an unusual personal tragedy. Each family has or has just lost a child with a rare congenital disease called MPS. It means the child's body stores dangerous chemicals called mucopolysaccharides. Over the years, the MPS chemicals cause brain damage, twisted bones, difficult breathing, deafness and blindness. In Britain, there's a small but tragic group of 400 MPS children, most of whom are likely to die before the age of 10. Until 4 years ago, MPS children were utterly without hope of a cure. But recently, for a tiny handful, there's been a faint chance. A year ago, James Astbury had fading sight and hearing, coarsening features and deformed limbs. Today, all that's gone. James was one of the lucky few who were offered a highly experimental new treatment for MPS, bone marrow transplant.
Without the transplant, it was 100% certainty that he would die. So, to us, giving the chance, as the hospital at London gave us, to have the transplant, we took it. We didn't even think about it.
He would have probably lived till he was about 15, and we wouldn't have liked to see him deteriorate. He would have gone deformed and deaf and blind. We wouldn't like to have seen that.